Hello and welcome again to another audio and PowerPoint related to the research course. Today I'm going to be talking about Introduction to Qualitative Research. Our learning objectives are to, one, describe the beliefs held by qualitative researchers, then differentiate between qualitative and quantitative research paradigms, and we've done a little of that already. Describe the components of a qualitative research report. Identify how qualitative research can be used in evidence-based practice. So, pretty short one, not a lot to go over today, so it should go quickly. I do want to add that I am not going to be doing an audio on the PowerPoint about the historical research that has been done. And so just don't be watching for that, because that's not information I'm real familiar with and don't feel like I could do a good job. So please look it over, and if you have any questions, I'm kind of looking. I think there's some historical information on the web, but like I said, I'm not an expert on that person and her history. But there are some people at Nevada State who are, so if you are more interested in finding out more information, let me know and I'll connect you with that. Anyway, so philosophy underpinnings of qualitative research. Qualitative research tends to look at kind of what is the truth, what is reality, and believe that there are many different truths in reality. For example, you've probably been in a class and then after, or a lecture, and afterwards been like, oh, I'm so pumped, that's so exciting, I learned so much, and other people are like, oh, that was the biggest waste of time, I cannot believe that that just happened. People can have very different reactions to the same thing. I hope you're looking at the picture right here, and some of you might be seeing kind of a beautiful woman looking to her side, and kind of the back of her head, or well, I guess that's more of cheek and neck. And other of you might be seeing kind of an older kind of haggish lady there. And you can flip back and forth between those two. There's two different realities, but in reality, it's one reality. So I hope that makes sense. And so with that in mind, the qualitative researcher believes that there are many possibilities, many different people's views, many different contexts, and then context will define and to relate with the person, so that there isn't just one truth and they're going to find it and then report that, but realize that there are many truths. So when you're looking at qualitative research, it is different than the quantitative, and that qualitative looks at each person having their own view of what's going on, and the researcher and the subject are co-participants in the process. Researcher is supposed to be able to, quote, bracket themselves and remove themselves supposedly from the research, but in reality there's always going to be a little bit of their own personal emotions happening. Like I say in another video, an audio, it's impossible to separate yourself completely from a process that you're energetic and enthusiastic about. And most people do research on something that they're really interested in. That might be relating to experiences they had as a child and childhood obesity and that. And so when you're then studying childhood obesity, it's impossible just to say, oh, my experience doesn't count. It's always going to be there. Cancer too. If someone's had cancer, or like a relative that's died of cancer, they're going to bring some emotions and have some feelings about that they're going to bring with. And that's okay. That's what qualitative research is about. And also, in terms of a type of study, also you could look, what is the meaning of cancer? I want to add that in and kind of identify what does it mean to have cancer for those individuals, and seeing that everyone has a little bit different view, but there can be some collective and some themes that would show. Quantitative research believes there's more one reality, and if we can get the right test, the right tool, the right questionnaire, we can figure that out. So researchers stay much more neutral, and in reality, once again, it's impossible to be completely emotion-free, but it tends to be a little less connected. The participants are considered the subjects, not co-participants in the study. And an example of a quantitative research topic might be, what drugs cure cancer? So more of a specific, to the point, not someone's opinion or belief, but a fact related. You'll hear people talk about inductive and deductive reasoning. Inductive reasoning, you go, and what I like to say is go increase. You go from smaller experiences of maybe a few people and then enlarge that thought. So you go from specific to general by increasing inductive. And so you might be figuring out what's there from in terms of observing and seeing the details of what's happening in terms of like nursing practice or a patient's experience. And it can often be used to build a framework. So there might not be any research in the area, but the researcher does their work and comes together at the end and develops some sort of theory or framework, or at least conceptual model that can be used for future research. And that's about the qualitative methods, looking at words more than numbers. Deductive, you can think of deducing, decreasing, going from general to specific frameworks, including a search for what's there. It usually begins with some sort of literature review, some framework, and then quantitative methods tend to be very number-oriented versus qualitative more word and theme-oriented. So you might give out some surveys to hospital staff on the importance of hand washing, and ask them different questions about the hand washing and what they feel about it reducing infections or something like that, and then bringing that information down and saying these are the numbers. 20% believe in this, and 15% believe in this, and 25% actually do this, and so going from that larger to specific numbers is more of a deductive and a framework than a quantitative with the N. Think of also quantitative as the N for numbers. It's number oriented. So in terms of quantitative research, talking about empirical, they have a specific view of the world that once again you can count it, you can measure it. There are some variables that can be held steady, and that's something that they're very much oriented to. Their goal is usually to either support a research hypothesis or a research question. Assumptions that a quantitative person is that the world is predictable, that humans respond in a way that can be measured and understood, particularly by some sort of tool. Qualitative research, there's different types. You'll hear of grounded theory, case study, ethnographic research, phenomenological research, that's sometimes hard to say in the afternoon when you're feeling a little tired, and historical research. And the paradigms is you perceive and you view. You see what's there and make notes of that. And they seem to describe, it's more of a descriptive sort of research. But there is exploration and description. And there are some assumptions that humans are very complex, and each person has their own world and their construct, their understanding of the world. And so reality varies from different times and different contexts and different people. So nothing's the same for everyone and anyone. Components of a qualitative research report, there's oftentimes, but not always, a review of literature. Sometimes there's just no literature review, or sometimes researchers don't want to look at the literature because they feel it might influence their understanding what's going on. There is a study design. They're going to want to have some sort of plan. The sample, remember, that is the term which describes how they collect the people. Sampling methods is how you collect, and then the people themselves is the part of the population. You would say this was our sample of people. The setting is where it happens. It might be a school, might be an ER, might be an OR, might be out in the field, for lots of different places. Data collection often is through interview. There might be a semi-structured interview in which there's a few questions that they always ask, and then depending on the question and responses they get, they might ask some more questions. That oftentimes is either taken down in, as notes and or recorded and then transcribed into words later on. Data analysis is through coding. The person reads and then makes notes and kind of puts things together and try to organize things in a reliable, understandable way. And findings is what they come up with. And you'll find that in the research reports. And there's usually a discussion and a conclusion. So what do we do with that? Is that from there? So with the literature review, you establish significance of the phenomena, will make a difference. Why are you studying it? Are there anything relevant that needs to be discussed in terms of previous studies or other experiences? The study design depends on what type of qualitative method it is. Phenomenological is the meaning of life lived experience. So those are things about, what does it feel like to be this person? Grounded theory, very similar, usually more of social processes. So what are the interactions between people? Ethnography is looking at culture, and it still might be a small group of people, like the culture of a med-surg floor could be included. Historical looks at past and past experiences, and case study is often looks at experiences of maybe one or two specific organizations or things and what happened, and often to learn from that experience to help people in the future who might go through similar or avoid those experiences. The sample who are collected is usually small, less than 30. Once again, it depends on the study and the length of the study. It might be bigger than that. Purposive sampling I mentioned is you take a look at who would be the most informative. Who do you want to choose specifically rather than just kind of randomly choosing people. Inclusion or exclusion might be related to their diagnosis, their age, their ethnicity. Data saturation, you'll hear this and see this in papers, and it talks about, like, you'll see usually a statement, data saturation was achieved. That just means that they just started hearing the same thing again and again, and they stopped hearing something new, and it's like, okay, we got it, figured out. That's data saturation. In the setting, they often will use information about it. This is maybe a home or support group. Usually they'll try to protect the individuals to some point, particularly if it's sensitive information. For example, if they were interviewing people who had been experienced a rape or a tragedy of some sort, there can be less informative of who and where they collected those people, just for their own privacy. Data collection, hear about bracketing and identifying a set of, well, this is once again talking about the researcher, and the researcher is supposed to be able to figure out what their emotions are and pull out those assumptions and biases as they're listening and as they're thinking and as reviewing. There often will be very broad questions like, tell me about what it was like when you had this disease, or how do you feel about this? And it lets the person kind of go in their own direction. It doesn't lend to like yes or no or multiple choice questions, this type of research. Once again, the data collection could be interviewing. There might be individuals who are either recorded or transcribed or notes are taken. You can also have a group, and oftentimes you hear people talk about focus group. That would be a qualitative research method. Written data, it is possible to look at people's essays, either historically or ask people can write about this or that. Field observations too. People might go out and take notes and watch. Maybe there might be someone who wants to look at interactions between children or something like that. They might sit in the playground and take notes and watch how kids interact and see what they find. Data analysis, they dwell on the data, really think about it and kind of immerse themselves in that, listen to the audio tapes, read the transcripts, and do this again and again and again to get a strong feeling of what it's about. They look at for commonalities and differences in data. What is the same between people and what's different? And they'll then use that and categorize and put themes such as, what is the support of disabled pregnant women? Or a theme, for example, they might be looking at cancer patients. Pain might be a theme, or feeling of loneliness might be a theme. And they would then collect the statements by the people that relate to that and put them together. There are data management programs that can help. Even Word can help in terms of identifying themes and color coding. You see a word or a phrase about pain, then highlight that and maybe a brighter color. Positive feelings might be, also highlighted and grouped together too. Findings, depending on what the purpose of the study is, different findings are going to be come up with. Usually there's a set of information about the processes and what they got, and what does it mean? What are these themes, and what do the themes say about the people to say to other things? As they're writing in the findings of the article, you'll see a lot of quotes, and that helps give strength to it. So rather than just saying some quick little sentence about, let's see, maybe that insurance companies are problematic and reduce nurses' ability to care for patients. They might say that, but then also give some quotes. I spent hours and hours, this might be a nursing quote, I spent hours and hours doing paperwork when I really could be with my patients. Or I feel so sorry for my patients because they have to deal with this paperwork that drives us all crazy, and they have more important things to really consider than this. It is possible to have numbers and say things like, 30% of people talked about this and 20% that, but it's very less common in the qualitative, much more common in the quantitative research. The discussion and conclusion part would say, this is what we found. If there are other studies, you might see the literature brought up again back at the end, or maybe even sometimes for the first time. They'll describe what new ideas and discoveries come in, then so what are you going to do with it? What are the implications for practice and for future research? What should be done now that we came up with this information? So how this fits in with evidence-based practice is that qualitative research can give information about, for one, what new questions should we be asking? What perspectives should we be looking at? It helps us understand the patient's concerns, also nurses' concerns, and gives us more insight into what we are doing clinically and how best to practice and work with our patients. Qualitative research has many different uses. It can help us have insight and empathy onto people. It can help us in terms of assessment, what's going on. It can give us some information about what might be ways we can help our patients in terms of anticipating what's going to happen in their life and coaching them. Hey, you know what? Oftentimes people who have this experience also feel this way. If you're feeling this, these are some things you can do. Reach out to people, talk to people, that sort of thing. Help people kind of know what's coming and move forward. We do have to realize, though, it must be applied in context. If there's only a small sample and maybe they're taken from a different region or a different group of people, sometimes we have to wonder, is that really valid? Is it really going to work in our setting? So it's something to consider. It doesn't mean it will absolutely not, but it's something to definitely keep in mind as we move forward. So that's this presentation. I hope you learned something, and please look over the book and let me know if you have questions. Bye now.